Your pet received general anesthesia and pain medication today. It's normal for them to remain tired, sleepy, and just not their normal self for the rest of the evening. After a good night's sleep, most pets wake up in the morning feeling more back to their normal self. This evening it is important that you protect your pet by confining them into one room and keep them away from other animals and small children. They can have some food to eat this evening if they act like they're not dizzy. If they're unable to stand and walk in a straight line, then they are dizzy and should not eat. When it does become time to feed them only a small amount. This is a small handful of food. If they eat food and keep it down for an hour and want more, they can have another handful. No big meals tonight. If they don't want to eat until tomorrow, that's okay too. Tomorrow evening, you can feed them in a normal fashion. Your pet does have an incision from the surgery. Females have an incision just below their belly button. Male dogs have an incision in front of their scrotum. Male cats have an incision directly into their scrotum. You should monitor these incisions on a daily basis. Tonight there will be a small amount of bleeding from the incision, but by tomorrow there should be no discharge. The incision should not look red or puffy or have any drainage. You should not allow your pet to excessively lick at the incision. If your pet cannot stop licking the incision or the incision starts to look red and wet, you'll need to put on an e-collar. These can be picked up at the pet store. You'll also likely notice that the female animals have some green tattoo ink in or near the incision. These animals and some small dogs will be going home with a permanent tattoo to mark them as spay and neutered. It's important that your pet rest for the next 7 days. This means staying inside and for dogs being on a leash when going outside. You should not encourage the pet to run around or play. Your female pet or your male dog will be going home with pain medication. This medication is called Metacam, and it's a non-steroidal anti-inflammatory drug. Male cats receive pain medication today and do not seem to need any more at home. The Metacam is easily administered by mouth starting tomorrow at noon and then the same the following day. This medication lasts for 24 hours, and we already gave today's dose. If you can't give it orally, you can squirt it into their food. Just make sure they eat it. You will be going home with a dismissal sheet with Dr. Kim's cell number. Please call it and leave a message or call back if your pet is having any problems.